Good afternoon, Dr. Desmond White, gastroenterologist. There's some question about what is liver function, and some of the followers actually tell me that, oh, my liver function test is not normal. But actually, the liver function test that you did with your family doctor or health screening center is not really a liver function test. I repeat, a liver function test at the lab is actually not a liver function test. Let me explain. The liver panel, we call it liver profile or liver panel in NUH. In Parkway, we call it liver profile. It has a list of items. Let me list them to you. First, bilirubin, albumin, ALT, AST, alkaline phosphatase, gamma GT. These are not really liver function tests per se. One by one, let me explain. The liver clear bilirubin. So when the liver doesn't clear bilirubin, the bilirubin level goes up. So in my patient that have liver problem or have hepatitis, for example, the bilirubin goes up. That means the liver is not clearing the bilirubin. So it tests on the clearing function of the liver. Albumin is manufactured by the liver. So the liver makes albumin. When the liver is sick, it doesn't make enough albumin. So albumin tests on the synthetic function of the liver. ALT, AST are stored in the liver cells. When the cells break up, when the damage or injury to the liver organ, the cells break up, so the content are being released to the bloodstream. So ALT, AST measure the amount of liver damage. Alkaline phosphatase, ALP, and gamma GT they are elevated when there's something blocking the bile duct, big or small, of the liver, and they'll go up. So the whole liver profile does not just measure liver function. It measures certain function of the liver, the damage of the liver, what type of liver injury, like does it damage the liver cells or does it block the bile duct. So when we say liver function test, it's not actually a liver function test. And there are some caveats. For example, bilirubin can go up not just in people having a liver issue that they don't clear the bilirubin. If someone have a hemolysis, the red cell breaking up, or they have a bile duct blockage, not a liver problem per se, they can have high bilirubin. And albumin doesn't just measure the synthetic function of the liver. If the person is ill, have other illnesses, as easy as a dengue fever, the liver may make less albumin. And ALT and AST are also found in other parts of the body, such as red blood cells and muscles, so they can go up in people having muscle injury. Gamma GT can go up in people take certain medication or drink a lot of alcohol or just being fat. And alkaline phosphatase can come from the placenta, can come from pregnancy, can come from the bone, can come from other organs. So, in other words, the whole liver function test does not just measure liver function. There are many caveats. They measure different aspects of the liver function, but not the whole liver function. So, if you see a doctor and the test or liver function test is abnormal, discuss with the doctor to find out what exactly it is. Most likely, you need further tests to find out what is the issue. And in a Parkway lab, we tend to call it liver profile. In NUH, we call it a liver panel. They are more appropriate term than liver function. So, and the liver, you may have a normal liver function test. It can be as easy as say you're pregnant. Your alkaline phosphatase, ALP can go up. Or you drink a lot of alcohol, your gamma GT can go up. So the liver function test being abnormal does not necessarily mean something wrong in the liver. So to sum up, it's actually very complex. Further tests, further investigation need to be done. Of course, if your doctor is experienced and seasoned and trained in this area, they can get to the final diagnosis quickly. And you do need to see a doctor, your family doctor first, and do the workup to find out what's wrong with your liver function test LFT when it's abnormal. Dr. Desmond White.